Hello, my name is Henry Silverman, and today I'd like to give a presentation on the science and art of doctor-patient communication. Doctors and other care providers may want to ask, why learn effective doctor-patient communication? Well, let me discuss several reasons that addresses this question. First, doctor-patient communication has been linked to improved patient satisfaction, better patient care, and a decrease in malpractice lawsuits. Second, effective communication may increase patient understanding of treatment, improve compliance, and in some cases, lead to improved health. Finally, communication is important not only to the care provider-patient interaction, but there are important benefits within the healthcare system. These include better working relationships and better handoff communication of patient information between change of shifts. A related question is, why master effective doctor-patient communication? Communication is the most prevalent behavior in a clinician's lifetime. Effective communications help with the diagnosis and treatment of disease. It helps to establish and maintain a therapeutic relationship. And effective communication helps with giving information and providing education to patients, which leads to empowering patients. There are also important impact on outcomes from effective communications with your patients. Studies have documented the following impact on outcomes. For example, enhanced symptom resolution, better pain control, improved physiologic responses, enhance emotional health, and better treatment adherence. What doctors need to do is to, 1, gain the ability to elicit information from patients and give them the necessary information, and 2, acquire the interpersonal skills to respond to patients' feelings and concerns. However, there are several problems with doctor-patient communications. Studies have shown that about 45% of patients' concerns are not elicited in the doctor-patient interview. 50% of psychosocial and psychiatric problems are missed. In 50% of visits, patients and physicians do not agree on the main presenting problem, and patients' most common complaint is the lack of information. Since communications is the most important when we see patients, let's review the functions of the medical interview. This slide shows the major components of the medical interview. The first component involves setting the agenda when the patient comes in to see you. One needs to identify the problem or the problems that the patient wants to address during this visit. This entails eliciting complete and accurate information, observing essential data, and then forming and testing hypotheses. Another important component in the medical interview involves eliciting the problem from the patient's perspective. After developing potential diagnosis and the treatment plan, one wants to provide education and counseling to the patient. Afterwards, one desires to negotiate a mutually agreeable treatment plan, followed by a thorough explanation of the recommended courses of action. All these facets of the medical interview involves effective communication techniques. This slide shows a pictorial view of what I just discussed. We see here agenda setting, eliciting and understanding the patient's perspective, patient education, negotiation and agreeing on a plan, and then closing with a thorough explanation of the recommended courses of action. Throughout the interview, one wants to use relation-building skills, which we'll go over, and manage the flow of information. Let's discuss more about agenda setting. First, a question. How much time do you think passes before the average healthcare interview is shifted from exploring the patient's agenda and concerns to the interviewing asking specific focused questions? 30 seconds? 60 seconds? 90 seconds? The answer? Physicians often redirect patients at the beginning of the visit, giving patients less than 30 seconds to explore their concerns. As such, between 30 and 80% of patients' expectations are not met in routine primary care visits. Patients forget more than half of physicians' clinical recommendations as they do not relate to their agenda. In regards to agenda setting, one should elicit complete and accurate information, observe essential data, and form and test hypotheses. Questions to consider to ask patients in regards to setting the agenda include, what brings you in today? Or, many patients may have several things to discuss. Before we get started, what all would you like to address today? Am I asking the question correctly? Question formats that should be avoided include the leading question, for example, no chest pain, shortness of breath, or nausea, right? Avoid the use of double negatives, such as not been unhealthy, right? Also avoid close-ended questions, such as, so, you've had squeezing here for 2 days. What you should have asked is, tell me more about your pain. Several communication skills to use while eliciting the history includes the following. First, use silence effectively. Allow the patient enough time to express thoughts or feelings. Second, actively encourage patients through the use of supportive words or comments. For example, tell me more. I understand. Third, learn the importance of nonverbal behavior. And learn how to use open exploratory questions, thus inviting the patient to become actively involved. Exploratory questions such as, tell me more, how did that happen, what did that mean to you? This slide shows some helpful advice in regards to eliciting the patient's perspective. Start with open-ended questions. Invite the patient to tell the story chronologically. For example, why don't you start from the beginning of your illness? Actively listen. Use verbal and nonverbal encouragement, such as, anything else? Tell me more. Allow the patient to talk with minimal interruptions. Summarize and check for understanding. Invite more questions. Anything more? Other tips to elicit and understand the patient's perspective? Explore beliefs and concerns. Ask about family, community, and religious or spiritual beliefs and values. Acknowledge and respond to patients' concerns, and also acknowledge frustrations and challenges. Understand and make use of nonverbal listening skills as it makes verbal communications more effective. For example, be attentive to gestures, tone of voice, eye contact. Practice effective note-taking while maintaining eye contact, and use attentive silence to allow the patient time to gather thoughts. After the history taking or the setting of the agenda, one performs the physical exam. But that does not mean communication needs to stop. So please communicate. During the physical exam, comment on aspects and findings of the physical exam or procedure as it is performed. Listen for previously unexpressed data about the patient's illness or concerns. After the physical exam and all the data have been obtained and analyzed, one must use effective communication techniques to provide patient education. Use the ask, tell, ask approach to giving information meaningfully. For example, tell the information clearly and concisely in small chunks. Avoid doctor babble. Use language that the patient can understand. You may want to use diagrams, models, printed material, community resources. And repeatedly ask for patients' understandings, and always encourage questions. Finally, negotiate and agree on a plan. Encourage shared decision-making to the extent that the patient desires. Offer options. Elicit patient understanding, concerns, and preferences. Arrive at mutually acceptable solutions. Check patients' willingness and ability to follow the plan. Identify and list resources and support, for example, family support. At the end, signal closure to the patient. For example, inquire about any other issues or concerns. Allow opportunity for final disclosures. Summarize and verify assessment and plan. Clarify future expectations. Assure plan for unexpected outcomes and follow-up. And finally, provide an appropriate parting statement. It could be as simple as, "Thank you." Other parting statements could be, "As we wrap up today, let's make sure we're on the same page." Or, "Can you help me remember what we've agreed to do?" This question is asking the patient to restate the plan. You may want to elicit potential challenges by asking, "What might get in the way of this plan?" Once all questions have been answered, stand up and prepare to exit. So in conclusion, the medical interview represents a core clinical skill. It represents the most time spent between the doctor and the patient. Communication is an important contribution to clinical reasoning, diagnosis, and outcomes of care. It's the most prevalent behavior in a clinician's lifetime, and well-established guidelines describe core communication elements as essential for every clinical encounter. Thank you very much.